So it's Wednesday night, and it's time for lesson of the day. It's about 9:30 p.m. Just finished the nice long day. I had a lot of consults today. Today it was a lot of facelifts and revision facelifts. So hi Anna Guanche and Javi. Oh, Javi, I saw that patient. I'll tell you about later. So the question today was why didn't my facelift last very long? So there are patients I saw today that had lifts 5 months ago and patients that had lifts maybe 2 years ago. And they were wondering why the lift didn't last or didn't do what it needed to do. Happy birthday, Brooke Sassa. Brooke's on here. Oh, yeah, Brookie, happy birthday. So there's good reason for this. I'll tell you, in my own patients, when I'm guiding them through things, they ask me, how long is the facelift going to last? And I say, the facelift, the way that I do it, which is like an extensive deep plane, should last about like 8 to 10 years, something like that, about 10 years. And that's based on studies that have been done, sure, but more based upon the longevity of what I realistically see in my patients and when I think the result is going to fall off or start to recur over time. So if you look at all research studies, and this is by Matarasso and Baker and a bunch of other people, you'll see that patients return, even with a shitty facelift, they'll come back at 8 years to get a revision. So the result may go away at 2 or 3 years, but they come back at 8 years. So that's kind of common. The deep planes and the more extensive deep planes, bigger releases, tend to last a lot longer. And I have to, hey, question, do you mind grabbing from the front? The guys there. Oh my God. So tend to last a lot longer. But I do tell my patients, you'll still have to do some maintenance. Just because we're lifting does not mean that you're not going to need other things. And the way I look at it, I break it down into 3 different types of aging. One of them is drooping. One of them is deflation, so loss of volume. And the last one is skin changes, and that could be also deflational changes. The deflation or the loss of volume, we can refill with fillers or fat, Sculptra in some cases. The drooping we fix with lifting, and the skin quality changes we typically change with lasers or radio frequency treatment. So I can lift someone to the sky and they could still have crepiness in the skin that needs to be treated. That's separate from doing a facelift. So that's one of the reasons people wonder why their facelift is failing or if something was left untreated. And usually in the first year, people love the results, and they love it because they're more swollen. And after the swelling goes down, then they start to see the other things that were either untreated or a facelift that just wasn't lifted enough. The more classic kind of SMAS plication lifts, which are the it's not antiquated, but it's the one that's been around a long time, where they actually just lift up the skin and then tighten up the muscles, have a high chance of recurring or falling back down after about 2 to 3 years. And there was a paper, I think, written by Frank Kamer back in the day who described the serial facelift, which he described that his patients, because he's a very realistic guy, would come back in about 2 to 3 years for a touch-up because the first one didn't really last so long. And this is because the not older types of facelifts, but the SMAS plication types of facelifts, which weren't the substantial ones, tended to work better in the neck, not so much in the face. Even though it's called a facelift, it was really a neck lift with a lateral facelift because they pulled the lateral part back. The mid-face never got lifted, and then the neck doesn't go up as high because it never went up with the face, so it tends to come down over time. So when patients have that smaller type of facelift, whether it's a mini facelift or smaller SMAS plications, they tend to recur after about 2 to 3 years. In addition, they might see deflational changes, they might see the skin quality changes and all of that. The mini lifts, for that reason, I tell patients, don't do something called a mini lift. If you're going to do anything, do it properly, because your healing time is going to be the same. The look is going to be better with a regular lift. Scarring is going to be worse with a mini lift, and then the duration of effect is going to be shorter with a mini lift. So generally, the bigger lifts that are done well heal in the same amount of time and look better anyways, but don't ever think that you're not going to need other treatments or you're not going to need a facelift again. Upper eyelid surgery is the same. I had a couple patients come in today saying I had an upper eyelid surgery maybe like 10 years ago, but I feel like it's lived its course. Was it not done enough? And I said no. Different things happen. So the upper eyelids themselves may recur a little bit in laxity, where you get extra skin again. The brows might come down a touch over time, or you might get deflational changes again, where you get hollowing, and you might get skin quality changes where you get wrinkling. So in those cases, you can touch up the procedure by doing lasers or chemical peels for the skin quality. You can add volume by adding filler or fat, or you can redo the surgery at that point. So for aging face surgeries, with the exception of a lip lift, you should assume that the more substantial ones with the bigger changes and less scarring tend to last about 10 years. The stuff that has more scarring and less of a change lasts maybe 2 to 3 years, 5 years, depending what it is. Things like brow lifts, if they're done well, can last 10 years if you maintain with Botox, and sometimes if you don't maintain with Botox, they can fall down faster. So that's the lesson of today, because I had to tell patients this a couple of times. So I hope it's helpful. I'll see if there are any questions here. Is she a beard or real? I'm not sure what that means. Is he gay? No, he's not. I love homosexuals and they're my best friends, and they're very extremely funny. I'll just read these comments. Wait, is he gay? I didn't get to read any of these. So what's your opinion not to have to come back? There's no way to fully prevent coming back to a plastic surgeon. Unfortunately, you will need maintenance on some things no matter what you do, sometimes with a dermatologist or that. He is a homosexual? Question mark. How do you feel about PDO threads? Longevity for the patient's younger surgery. I don't do PDO threads. I think they're fine to do a couple times if patients are trying to get a little bit more of an improvement in the mid-face than what fillers alone can achieve for events and things like that. I don't believe they can give you a brow lift or a lip lift or anything, but you can get some improvements along this area to that area. In the neck, I've been very unimpressed with the small threads. There is a Dr. Mueller, I believe, in Beverly Hills, who does something called a trampoline lift, and he does a very intensive thread lift that works, but it's pretty intensive. He goes across with threads, trampolines, and cuts the muscle and does a bunch of things. So those have a higher tendency of working. Best age for the aura lift. So the aura lift is a modified extended vertical vector deep plane face and neck lift. That means what we're doing is lifting the soft tissue of the face and neck from here all the way down to the collarbone. And there's no proper age for it. I've done it on 25-year-olds when they have droopiness and acne. And but I'd say for most patients, for aging and laxity, it's usually between 45 and 55, which is commonly what you see now for facelifting. Let's see. Why are hyaluronic acid injections not allowed here? They seem to be fine in Europe. They are allowed here. I need a major overhaul. Love your job. Amazing. What do you think about face yoga? What is face yoga? I don't know how to downward dog a face. I love your soothing voice. It's kind of like gay. Maybe that's where it began. Does LED light therapy work on the face for anti-aging? So another question I got today from a very cool patient is whether or not hyperbaric oxygen can help patients, I'd say, stay younger, fresher, healthier, things like that. And there was a study that came out from Israel recently saying that they noticed a lengthening of telomeres, which are the tail end of your DNA, over time with hyperbaric oxygen treatment. That itself does not prove or show that it prevents aging, just because we see telomere shortening with aging, because we don't know what telomere shortening causes. It has a relation to certain disease processes and aging, but there's no direct causation that we've seen before. So we don't know if hyperbaric oxygen makes people look younger or anti-aging or anything like that, but it is certainly helpful in healing and swelling. Does LED light therapy work on the face? It does make it glow for a little bit if you use like really nice LED panels. Probably glow for about like a month or so, which is interesting. I'm not sure how that works. but it does work overall for inflammation. It helps inflammation calm down a little bit. It does work for chronic back pain. They've seen effects of it, benefits of it, and some patients have seen improvement in blood pressure over time and anxiety with LED light therapy, which is kind of interesting. So, stop talking. That's not a question. Okay, so that's better. How do you feel about thread lifts and hola desde Mexico? And perfect. And I missed a bunch of stuff. There's like a rude and disrespectful. Oh, this is getting interesting. All right, well, it's late now. I'm gonna go and say hi to Dove, and I will post this in case anybody is wondering about it. And I do have other stuff that I'll talk about next week as well.